Cancer in Ayurvedic perspective. Among the three diseases associated with the lifestyle, cancer is very well known for untimely, miserable death. As a consequence, there is a tremendous fear about this disease, about the treatment like chemotherapy, radiation, and about the sufferings the patient has to face. This then leads to stress, depression, which further aggravates the disease to worsen the situation. The fear or the tension starts even with the suspicion of the cancer and advice for FNAC, fine needle aspiration cytology, or biopsy. With the confirmation of the diagnosis of the disease, the stress is at its peak. The fear and the tension continue to increase during treatment. If the cancer is diagnosed in very advanced stage and no treatment can be administered, there is a hopeless situation. In spite of treatment in the form of surgery, chemotherapy, or radiation, some patients do not respond, leaving them again in a hopeless situation. Some patients, after completion of the conventional treatment, enter a so-called disease-free state. In this state, the disease is not demonstrable by any investigation. At the same time, it is not known whether the malignant cells have been totally eradicated or not. So, investigations are periodically carried out to know about any recurrence or metastasis. If recurrence or metastasis is noted, again the conventional treatment in the form of surgery, chemotherapy, or radiation, whichever appropriate at that state, is imposed. But now the success rate is low. Either there is no regression of the disease or there is recurrence after initial regression, leaving the patient again in hopeless condition. Generally, only in the hopeless situation, due to any reason, the patient turns towards Ayurved or any other alternative medicine. The stage is really advanced. The disease is progressive. There is lot of stress and depression, and the financial status also has gone down. It is a difficult task to bring patient out of depression and to try to cure them. Still, very good results have been obtained in some cases by scientific approach of Ayurved. Hence, even in this state, the patients try to seek help from Ayurved. Let us try to understand cancer. In modern medicine, it is the uncontrolled growth of abnormal cells. There are various reasons due to which the normal cells become abnormal cells and start reproducing very fast. Some people are of the opinion that this process got triggered off due to hybridization process. There are natural mutations in the universe which create new species. However, being natural, it is not harmful. But when we artificially create it for a commercial purpose, it is unnatural and it leads to various kinds of diseases. The hybridization has started in both agriculture as well as animal farming. Since the hybridized species have lost their immunity, they have to be given prophylactic antibiotics, pesticides. Chemical fertilizers are also used to enhance the production. Since our body is made up from the food we eat, how come we are going to achieve immunity through this kind of food? Moreover, the harms created by chemicals are very well known now. The process of urbanization has worsened the situation. Industrialization, pollution, transportation, etc. have emerged as a part of urbanization. Unhealthy lifestyles have been adapted in the form of lack of exercise, stress, competition, etc. The daily routine has been totally disturbed. Very fast we are getting away from the healthy lifestyle, traditional food, and are adopting fast food and junk food to a great extent. Psychological factors like fear, anxiety, stress, depression are continuously rising, producing more and more diseases. Addictions like alcohol, tobacco worsen the situation further. These are all the causes of cancer. Even an abnormal cell thus formed starts reproducing very fast and also produces metastasis or secondaries even at distant places. Ayurveda has a different system of diagnosis and treatment. We have to consider the hetu causes, purva rupa pre-symptoms, rupa symptoms, upashya upashaya relieving factors, anupashaya aggravating factors, and samprapti the variation of dosh and the process of creation of disease. The vitiation of dosha and process of creation of disease. For understanding any disease in Ayurvedic perspective, let us try to look at cancer with these factors. For a disease like cancer, we have to consider mainly two constituents of the body. One is dosh and other is dushya. 1. Dosh. Dosh are important as they are first vitiated or disturbed by the causative factors. Their imbalance leads to diseases. The dosh can get imbalanced either singly or two dosha, samsarga, or all three dosha together, sannipata. In most of the cancer patients, it is the third variety, that is sannipata, with predominance of vata dosh or vata and pitta together. Dusha. The dusha are body tissues in the form of dhatu and mala. They are also important equally in the cancer patient. These are the body components which get vitiated or disturbed by the imbalanced dosh, further leading to cancer. Loss of immunity, weakness, these dusha making them susceptible to an attack from dosha to form a disease. So the causative factors which create imbalance in dosha and suppress the immunity of dusha lead to cancer. Dusha can be judged by an Ayurvedic physician in three ways in cancer. 1. Involvement of organ. A primary or secondary lesion in the liver can be considered to be associated with the dushti of Raktavaha Strotas, a technical term, a kind of channel responsible for transportation of regenerative body tissues. In the same way, lung cancer can be associated with Rakta Dhatu, etc. 2. Strotas Dushti Lakshana. There are particular signs and symptoms which indicate the dushti vitiation of particular srotas. The symptoms can be noted and the involvement of particular dusha can be known. 3. Causes of srotas dushti. Some causes have been mentioned about the dushti of particular srotas. If we find these causes in cancer patients, we can decide the dusha on the basis of causative factors. So, if we are able to specify a dusha in a particular patient of cancer, we can plan treatment accordingly. In this background, let us consider the 6 factors to understand the cancer. 1. Hetu, causes. As mentioned earlier, the various causative factors starting from hybridization process, still changes in lifestyle have to be considered in Ayurvedic perspective. Ayurvedic physician has to identify the cause of the imbalance of the dosha and involvement of particular dosha. At an individual level, heredity, addictions, stress, depression, unhealthy lifestyle, and food habits are the main causes found. The website www.gadgilayurveda.com emphasizes on these aspects to identify proneness to cancer either at primary or at secondary level. 2. Purva Rupa, pre-symptoms. Loss of appetite, loss of weight is found in some patients. Painless hematuria, passing of blood through urine, leukoplakia, whitish patch in mouth, especially in tobacco chewers, is a pre-symptom. These are certain specific pre-symptoms presumptuous for specific types of cancer. However, the cancer is generally diagnosed in much advanced stage. 3. Rupa symptoms. These are according to the type and the stage of the cancer. The most common symptom is hard, immovable lump felt anywhere in the body. It is not painful initially and hence is neglected. Breast is very well known sight and at least those who have heredity should examine them periodically by themselves first and in case of any doubt immediately by doctors. Other lumps are generally noted in sonography, CT scans, etc. Losses of appetite, vomiting sensation, burning, etc. are additional symptoms due to chemotherapy and radiations. 4. Upashaya, relieving factors. Only milk diet, application of leeches, counseling, yoga practices, changes in mindset, lifestyle and food habits have been noted as relieving factors. One should have a proper judgment to implement proper changes. Anupashaya, aggravating factors. FNAC or biopsy, stress, depression, improper lifestyle and food habits have been noted as aggravating factors. One should understand and avoid them. 6. Samprapti. It is a very complex process starting from imbalance of dosha till the manifestation of the symptoms. An Ayurvedic physician has to judge the exact way of formation of diseases at an individual level and counteract it through proper treatment. The Ayurvedic diagnosis is thus very complicated and needs a sound theoretical as well as practical base. Though the treatment of an active progressive disease is very complicated or very difficult job, prohibition of cancer at primary or secondary level is an achievable target. Treatment integrated approach. Some Ayurvedic physicians have an integrative approach based on the assumptions of modern medicine. Best example is one can consider the uncontrolled growth of abnormal cells in the form of involvement of Shukra Dhatu and Ojas, and hence milk diet is a proper treatment as it increases both Shukra and Ojas. The fear, depression decreases the Ojas in the body, and milk again is a good medicine to increase it. Modern doctors, oncologists, oncosurgeon comparatively have a very vast experience as that is the first line of treatment worldwide. We can take advantage of these experiences to know the course of disease and to know the prognosis of the patient. Ayurvedic treatment can be planned to prohibit the progress of the disease thus known. This is also an integrative approach. Based on Ayurvedic principles, the treatment can be divided in following categories. Treatment Ayurvedic approach 1. Vyadhi Pratyanika Chikitsa Vyadhi Pratyanika Chikitsa Treatment acting against disease. We have to consider the treatment of cancer in various angles, since it produces ultimately miserable death. Rasayana rejuvenation is the first choice of treatment. It can be achieved through diet as only milk diet. Milk is the best amongst rejuvenating treatments. Other Rasayana medicines like Chavanprash, Vardhaman Pipli, Rasayana, etc. can also be administered. Dosh Pratyanika Chikitsa Treatment acting against dosh. One has to consider the imbalanced dosh and give proper treatment which balances it. Vata dosh is prominent in many cases and it manifests through severe pain. One needs to understand the exact nature of the imbalanced dosh and counteract it through massage, fomentation, etc. In the same way, if there is loss of appetite due to imbalanced kapha dosha, fasting to a particular limit is a treatment to reduce the increased kapha dosha. 3. Dushya Pratyanika Chikitsa Treatment acting against Dushya. There are specific medicines which have particular actions on specific Dushya. Once we identify the Dushya, as mentioned earlier, we can use these particular medicines. 4. Hetu Pratyanika Chikitsa Treatment acting against the Hetu, that is cause. If tobacco is the cause, tobacco being a toxic material for the body, we need to have an antitoxic medicine as Hetu Pratyanika treatment. Milk again is a good choice as it has antitoxic effects. Many other antitoxic medicines can also be used in Ayurveda. Panchakarma also helps in the detoxification process. In the same way, if stress and depression is the cause of cancer, proper thinking with the help of counseling or yoga practice is a treatment. If we understand the effects of chemotherapy, radiation in Ayurvedic perspective, we can use Hetu Pratyanika treatment to counteract the side effects of these chemotherapy and radiations. It was the improper lifestyle and the addiction that leads to malignant melanoma, a case already discussed in the introduction. Correcting lifestyle and de-addiction worked in her case at least to sustain without chemotherapy for 2 years. Administration of antitoxic treatment could have fetched her more results. 5. Lakshana Pratyanika Chikitsa, treatment acting against Lakshana, that is symptom. Though there is no direct reference for this kind of treatment in the text, various kinds of treatments have been described for varieties of symptoms in varieties of diseases. Here the question arises whether cancer has been described in Ayurvedic texts or not. Many Ayurvedic physicians consider it as an arbuda, which resembles cancer to a certain extent, but two varieties, Rakta arbuda and Manas arbuda, which are said to be incurable, resemble the most, but no treatment has been offered by the text for them. So, from a treatment point of view, this diagnosis is not sufficient. Some Ayurvedic physicians diagnose it as Granthi, Gulma, etc., with limited success in a few cases. Another question arises whether we should call it as a new entity and try to describe it on the basis of dosh theory by understanding the cause, presumptuous, etc. This would be a better approach, but then the Ayurvedic physician should have the vast experience of all types of cancers and all stages. Another question is whether this is a single disease or these are the multiple entities. The late Vaidya B.P. Nanal, renowned Ayurvedic physician, has specified 27 disease conditions in Ayurvedic perspective of cancer. But even then, he had something common in them in his mind. So it is rather difficult to say whether it is a single entity or multiple entities. Another important aspect is to consider it as local disease or a systemic disease or local manifestation of a systemic disease. Very often we come across the cases, especially of breast cancer, where after surgery, chemotherapy and radiation, no recurrence metastasis is found for a prolonged period. This signifies that it was a local disease and there was complete eradication of malignant cells, and also the reasons did not repeat to produce the recurrence. But in many other cases, we find the recurrence and metastasis indicating it to be a systemic disease which was not totally eradicated. I came across the case of malignant melanoma. One mole started increasing in its size. A biopsy was done and the diagnosis was confirmed as malignant melanoma. This mole was surgically removed. Then the other mole started increasing. It was also removed and the excision biopsy and confirmed the diagnosis. This went on till the removal of the fifth mole smoothly, but after the removal of sixth mole, the disease erupted all over the body, producing more than 300 tumors. This is clearly indicative of a systemic disease with local manifestation. With this background, let us consider the symptomatic treatment. Unlike modern medicine, even symptomatic treatment in Ayurveda needs consideration of disease, dosha condition, etc. It is difficult to consider disease due to the controversies as mentioned above. But we can definitely consider dosha condition, etc. I have been successful at least in relieving the pain and giving better quality of life even in the terminal stage. There are varieties of complaints like loose motions, constipation, insomnia, and varieties of pains. These can be dealt successfully in many cases. Even symptoms due to the side effects of chemotherapy, radiation can be dealt with successfully. So it is better to start Ayurvedic holistic management along with chemotherapy and radiation to minimize the side effects. It is also observed that sometimes due to chemotherapy, the WBC count is much lowered and the next chemotherapy cycle has to be delayed for it. But if Ayurvedic treatment is concurrent, then this does not happen and one can complete the chemotherapy without delay and with minimum side effects. 6. Adjuvant therapy, yoga, counseling, massage, diet consultancy, physiotherapy, astrology is adjacent to Ayurvedic treatment. With a holistic approach, yoga helps in many ways, keeping physically fit, relaxing stress, keeping the mind calm and quiet, and keeping the strength to fight against the disease. Counseling helps the patient to think properly, relieves stress, depression, and gives courage to fight against the disease. Massage relaxes both body and mind, helping her to come out of stress. It nourishes the body, produces good sleep, and helps for longevity of life. An Ayurvedic diet consultant is able to find out exact dietary causes, suggest appropriate ways to improve the diet. Consultant is useful in all diseases as our body is built up as per our diet. When no reasons are traced during this lifetime, or the reasons are not sufficient to produce such a dreadful disease, astrology can find out the lacunae according to horoscope and suggest some ways to counteract them. At least there is a satisfaction that some cause has been identified for the disease and some way has been suggested. The physiotherapist can assist the patient for better quality of life with simple exercises. A human touch in this holistic management is also very much important. When one interacts with somebody and spends time with him or her in talking, explains his or her pains and sorrows, there is a dialogue and this relieves the patient irrespective of its curative values. Unlike modern medicine, this is not a mechanical treatment in which nobody is allowed to express him or herself. One has to participate in the process of treatment for which he or she should be explained about the disease, the treatment modalities, etc. That is why this holistic approach is more friendly, more relaxing and relieving.